going to focus on the ECG, and this will be the changes with respect to different heart blocks. So let's start. So firstly, we are going to see the first degree heart block. So in terms of the first degree heart block, what does the ECG show? There is a prolonged. So there is a prolonged PR interval. Next we move on to the second degree. So the second degree is nothing but the Mobitz. So it is Mobitz type 1. So it is nothing but Mobitz type 1, and it is aka the Wenke back. So here, what is the ECG? So here the ECG is that the PR. So the PR interval, it lengthens. The PR interval lengthens, and until 1 P wave. So PR interval, it lengthens. So this is until 1 P wave isn't followed. So it is until 1 P wave isn't followed by a QRS complex. So 1 P wave, it isn't followed by a QRS complex. So this is type 2. Next we'll move on to the second degree. The second degree, and this will be nothing but the Mobitz type 2. So earlier we saw the Mobitz type 1, this is Mobitz type 2. So here the PR interval, it remains constant. So PR interval, you can call it constant, and this is in successive cycles. Constant in successive cycles. So it is constant in successive cycles. Then we have the P waves. The P waves, if you see, it is not followed by a QRS complex. So P wave is not followed by the QRS complex, and this is nothing but it is for every few beats. So every few beats this is seen. Lastly, we look at the third degree heart block. So in terms of the third degree, so third degree, it is nothing but it is known as a complete heart block. So complete heart block. So in terms of a complete heart block, the ECG, it shows no relationship. So there is no relationship, and this is between the P wave, between P wave and the QRS complex. So there is no relationship. So this was about the ECG changes in case of different heart blocks. To learn and grow daily like this, please do subscribe.